Good evening, this is Ron Burgundy.
And Peggy Watson.
And welcome to King 17 News.
Today, breaking news is Donald Trump's budget cuts. With grants and program funding and public health programs are being cut. We'll talk to 3 program directors today about their innovations and how they will be affected by these cuts.
Yeah!
Hi, this is Simran, Program Director, reporting live about spiritual care. The University of North Carolina Medical Center is just an example of a hospital which provides spiritual care services to its patients. The services they offer are chaplaincy services, bereavement support services, clinical pastoral education, and community clergy. Spirituality can be defined as the dynamic dimension of human life that relates to the way people experience, express, and/or seek meaning, purpose, and transcendence, and the way they connect to the moment, to self, to others, to nature, to the significant other, and/or sacred. Spirituality to treat patients was used in the past and was an important factor in healthcare before the rise of science and technology. However, with a growing interest in treating the whole person, it is becoming more popular. Many use spiritual care and religious care interchangeably, but these two are quite different. Religious care uses different religious practices such as prayers and baptisms. However, spiritual care is more broad. As it does provide religious care, it also provides counseling, therapies, and discussing the spiritual being of a person. One does not have to be religious to partake in spiritual care because there are many resources to help cope with illness that are not religion-driven. A study was done to assess the efficiency of spiritual care in North Carolina. From that study, they found that those who received spiritual care were receiving better overall health care compared to their counterparts who were not receiving spiritual care at all. Spiritual care works under the integrative model. It plays a role in medical care, preventative services, social policy, and health promotion. Spiritual care helps to improve health by focusing on physical, mental, and social factors, ultimately improving health and providing more holistic health care.
Thanks, Peggy and Ron, for having me on today's news. I'm going to go over my program and how later on and how it will affect the budget cuts of President Trump. So my program is called Let's Move, and I'm a program director that is coordinating with Michelle Obama. There's about 12.5 million children and teens in the United States that combat childhood obesity. The campaign started with Michelle Obama and the help of former President Barack Obama, creating the first ever task force for childhood obesity. They wanted to maximize on federal resources. The task force recommendations focused on 5 pillars of the First Lady's Let's Move initiative. And those are creating a healthy start for children, empowering parents and caregivers, providing healthy foods in schools, improving access to healthy and affordable foods, and increasing physical activity. So she focused on the military, and the military right now spends about $1 million in trying to get soldiers in shape for active duty. So she partnered up with the Department of Defense to help educate families on obesity and provide resources to the military bases with better access to healthier food choices. She also focused on parental awareness. She realized that parents are concerned about their children's health and physical fitness, which also influences their psychological behaviors as well. So she wanted just to make families have small changes to their health, such as having their kids cook meals at home so they can start changing their healthy diets. Parents are also aware of how body weight can affect low self-esteem and poor academics. So parents are getting together to advocate for more physical activities in schools. Another aspect of it is the food insecurities. There are so many food deserts in the United States, which is lack of access to food outlets and are a barrier to for a healthy diet. So having people walk or drive long distances to get to a healthy food market or a grocery store just isn't working, and so they're relying on fast foods to get food. So she initiated a food financing initiative, which expanded the availability of nutritious foods by developing and equipping grocery stores and farmers markets in the food desert communities. And the businesses also got a tax credit for helping those areas out. Another aspect is in schools, and she changed the criteria of what students were eating in schools, and she also worked with state funding programs such as WIC, Federal Assistance SNAP, breakfast, and school lunch programs. She also incorporated top chefs to help coordinate the design of the food plans. The populations that are affected by this, mostly, especially in the low self-esteem and poor academics area, is more prevalent in white and Hispanic females, and obesity is more prevalent in Hispanics and African Americans. And then the last aspect is higher BMIs in girls than boys. And then the last thing is it mirrors Healthy 2020's objectives because they both have goals of attaining high quality of life and also preventing disease. They also look at improving the health of all groups affected by obesity and improving behaviors to healthy eating habits. Thank you.
Hello, I'm Tasha, the Program Director for the Health Literacy Innovation. According to the Centers for Disease Control and the American Medical Association, only 12% of individuals understand how to take their medications properly, how to read their lab results, and other important health information necessary for good health outcomes. Poor health literacy is a stronger predictor of a person's health than age, income, employment status, education level, and race. Health literacy is a relatively new concept and a significant public health focus. Definitions of health literacy have been conflicting. It has been challenging to define and for one definition to be agreed upon. Many of these definitions focus on one's ability to understand health messages. However, a recent definition by Donald Nutbeam appears to embody the complexity health literacy holds. There's been a shift from focusing on what skills a person has to what the individuals are actually doing with these skills and how they are going to access health information, which is exactly what Nutbeam's definition of health literacy implies. Nutbeam's health literacy model is a model that addresses how health literacy can be improved, and it is used in professional literature. The model consists of 3 levels. The first level is functional literacy, which is the ability to apply basic literacy skills to health-related material. The second level is interactive literacy, which focuses on the development of advanced cognitive skills and the ability to operate in a social environment. The third level is critical literacy, which is the ability to facilitate community development through the evaluation of health issues. There are various similarities for these innovations. First, all 3 innovations are geared towards increasing positive health outcomes, and especially for vulnerable populations. These innovations help individuals gain more access to resources, which in result can improve the health of populations. These innovations also support more training and educational programs. Let's Move and spiritual care have psychological characteristic similarities, such as counseling programs. They all empower communities and individuals for change. Last, these innovations use agencies, government support, and community involvement.
All 3 programs mentioned earlier are specific to different areas of health and healthcare. Spiritual care is specific to mind and soul. This program uses counseling, therapies, and religious practices in order to improve health. The Let's Move program is specific to physical wellness. Its focus is shifted to physical activity and the body mass index in order to reduce obesity in children. Health literacy is focused on education and health knowledge in order to improve the health of the population by having more people educated about their health. These 3 programs all have different target populations. Spiritual care targets those with terminal diseases and those at the end of life. Let's Move is targeted towards children, while health literacy is targeted at adults.
Thank you. I'm going to add to the discussion now, and I'm going to talk about how the Bloom's model is incorporated in all 3 of our innovations. The Bloom's model has 4 different functions: environmental, lifestyle, hereditary, and medical care. So within environmental, socioeconomic status affects all 3 of our innovations because people that are struggling with obesity are usually living in poverty or have poor health because they cannot financially afford or have access to healthy foods. When people live in poor communities, they are less have less opportunities for good education, which is low education attainment, to learn how to read critically and think critically, which affects how they interpret their health and cannot grasp the healthcare environment and its complexities. So people living in poverty are also the ones who utilize the healthcare system the most, and because of the poor living conditions, and they also have more psychological effects. Most people are treated just for their physical symptoms, but also need to be treated in a more holistic way, which is more spiritual care. These vulnerable populations could benefit from chaplaincy services that would be provided to support with dealing with the fears, loneliness, ethnical values, and questionings of meaning of hopelessness and hope. So this can help establish a stronger foundation for the vulnerable populations and also decrease the psychological stresses. So the second aspect is lifestyle. So the foods children eat affect their health outcomes, as well as physical activity, if not properly maintained, can lead to heart disease, type 2 diabetes, asthma, all these non-communicable diseases. Also, when children and adults come into the doctors with these issues, it's important that physicians make sure they're listening to why they are doing these certain behaviors and considering their beliefs so they can be treated and better serve them as a whole. So in addition, these children living in poverty most likely are living in high crime areas, so bereavement services is a good option as well to help cope with loss in a healthy way. Health literacy impacts the lifestyle choices if someone doesn't have an adequate amount of health education and applying and being able to make healthy choices. Their lifestyle will most likely impact their health negatively. So their health and well-being will most likely decline in this aspect. So the third one is hereditary. With obesity, people may have genetic factors that influence them being overweight, but with lifestyle changes and healthy behaviors, it can decrease unhealthy outcomes. People with genetic disorders can also turn to spiritual care for additional support. Helps with positive coping skills if it's incorporated. How we respond to our genetic characteristics through health literacy impacts our health and well-being. So health literacy may not be able to change our genetic determinants, but however, health education and health literacy helps individuals are more likely to make healthier physical and mental choices that will help reduce or at least accommodate the negative genetic factors that individuals may have. Also, to be able to understand how to maintain a good quality of life associated with genetic factors in health, you have to have a solid foundation in health literacy to understand the information that's given to you. And the last aspect is medical care. Access to educational measures within obesity, spiritual care, and health literacy is beneficial, and without adequate access, people cannot maintain healthy lives and will become overly stressed. So with spiritual care and obesity in children, we need people to be counseled on psychological issues and not just focusing on physical aspects of obesity. When they have low self-esteem or poor academic performance, counseling helps, and also counseling can help in healthier behavior or healthy eating habits. These are all spiritual care counseling, so it's incorporated in Let's Move initiative. And then the last one is needed to be able to understand the information on how to eat healthier and the educational materials that they're getting from providers and health advocates is important so they can make those healthier choices and decisions, which is also associated with health literacy. Thank you.
One of the biggest problems many programs in the healthcare field struggle with are payment problems. There has been a decrease in government funding and grants, which ultimately reduces the amount of money a program can use. Amongst all developed countries, the United States has one of the lowest life expectancy. However, we have the highest cost per capita of healthcare, and this cost continues to rise. An increase in cost makes it difficult for individuals to pay for extra programs to improve their health. With the new debates and possible changes with the Affordable Care Act under Trump, There is a risk that services that were previously covered may no longer be covered, which will further increase out-of-pocket costs for families. In order for any program to be successful, it needs to have various resources to not only run the program, but to be able to provide to individuals in order to improve their health. Money is one of the biggest resources a program needs, especially in the healthcare setting. With the high healthcare costs, it is almost impossible to run a successful program without money. Another resource-related barrier is employees. Some low-funded programs do not have a wide array of employees available due to their limited funding. They are not able to keep staff for a long period of time, resulting in a high staff turnover rate. Another key resource barrier is educational resources. In order to have a successful program, there needs to be various educational resources available to not only staff, but to patients as well. There is some common history that is also prevalent amongst all three programs that we discussed earlier. Spiritual care, Let's Move, and health literacy all deal with individuals who have had low income barriers such as low educational attainment, low accessibility, and low socioeconomic status. Ultimately, this results in having a more difficult time accessing newer programs to help improve health.
Thank you folks for joining us this evening. The last 3 innovations that are important for you to remember: maintain good health outcome, keep investing in educational programs and networking.
And always empowerment within your communities, healthcare professionals, and public leaders.
Good day!
Have a good night!